Hey everybody, Dr. Dane here, and I just got done reading a fantastic book that I want to tell you about. It's called The Evolution of Medicine, and it's by a guy named James Maskell. And James is a health economist. He's not a doctor. What he's done is he's put together something called the Functional Medicine Forum, and he's teaching doctors to become entrepreneurs. And his work is absolutely brilliant. He is predicting the actual downfall of medicine as we know it because of the sick care system and the fact that we know that it just doesn't work and it's going to collapse. And so doctors, because of their long hours, because they've seen their reimbursements and pay go way down, because of the fact that they're just don't feel like they really are making a difference because they're constantly treating disease and prescribing medication instead of getting to the underlying root cause of the problem, are leaving medicine in droves. And he's helping them to look at a future of a functional medicine type of a practice. And he's developed a model, what he calls the 4P model of the practice of medicine that will be the practice of the future. And so the 4P model is this. Number one, first, it needs to be predictive. You need to help your patients predict their future. And so not waiting till somebody gets the disease, but being able to predict the disease in the first place. Number two, it needs to be preventative. We need to teach people behaviors that's going to prevent these diseases, because we know that most disease is lifestyle based. And so we've got to start teaching people. Remember, doctor means teacher. Docere is the Latin root word of doctor, which means to teach. The third thing is it needs to be personalized. And so we've got to personalize people's healthcare because that's what they want. If you were to go out and survey, he says, your communities and ask them, what do you want in a full-scale medical or full-scale health community-based wellness center? People want it personalized. They want time with their doctor. They don't want a one-size-fits-all model of healthcare. And so we've got to be able to deliver personalized healthcare to people. And then the last P is it needs to be participatory. People need to participate in their own healthcare. Gone is the days where we tell people what to do. We have to show them what to do, and more importantly, we have to incorporate systems to be able to hold them accountable to change their behaviors. And so we almost need to become psychologists in a way to help people participate in their own healthcare. So the 4P model, remember, it's predictive, it's preventative, it's personalized, and it's participatory. And so I ask you, are you developing your practice in a 4P model? Because we are maybe not a functional medicine practice, but we're a functional wellness practice. And one thing that we've done, and I think we've done a really good job, is predicting the future, because we're moving towards it with the model that we promote and the model that we teach with 8 Weeks to Wellness. And we're going to be doing 2 seminars that I want to tell you about. One is upcoming in February. It's going to be in Epsom Downs, England. And I'm really excited to do this with my good buddy, Dr. Joe Tilley, who, when I think about the 4P model, I don't know if there's anybody else who does it better than Dr. Joe and Zoe in their clinic in England. So please come join us. We're going to do a tour of his clinic. We're going to be talking about the principles of what does a functional wellness practice of the future look like. Literally, we're going to be going to Joe's clinic, and we're going to be going through the tenets of how to actually do and operationalize this model of practice. And then also, if you're in the United States, we'll be doing this at my office, and we're going to be doing this in April. And I will certainly get you information. You can go to learn8ww.com, so it's www.learn8ww.com for more information. But I'm going to encourage you to really get registered for those seminars. I'm telling you, this is the practice of the future. The question is, are you going to stick your head in the sand and act like the future isn't now? Or are you going to do what I did 10, 15, 20 years ago and know that this is the future of practice? And it's the best thing for you, it's the best thing for healthcare, and finally, it's the best thing for your patients. So we hope to see you at those events in 2017.